Hey guys, Jeremiah here to go over patient assessment medical scenario. It's a 15-minute scenario, and can I have my information?
You're dispatched to the home of a 55-year-old male complaining of chest pains for 15 minutes.
All right, so my BSI is on. I'm checking to make sure my scene is safe.
Scene is safe.
My nature of illness is chest pain. I appear to have one patient. I'm going to call for ALS, and I'm going to consider C-spine. In considering C-spine, I'm going to walk in, I'm going to introduce myself. Hi, my name is Jeremiah, I'm an EMT. I just want to start off by asking you if you've fallen or hit your head lately.
Oh, no, I haven't.
Okay, so I would consider C-spine, but it's not necessary at this time. My general impression, which is done from the doorway, is going to be a male patient sitting in a chair, and he appears sick. I'm going to assess responsiveness. So in order to do that, I'm going to ask my patient if he can tell me his name.
Matt.
Okay. Do you know where you are right now?
I'm at my house.
Okay. Do you know what the year is?
2017.
And do you know why we're here?
I called because I have chest pain.
Okay, so my patient is alert, and he's alert and oriented times the 4 questions I asked. So the patient is A and O times 4. Next thing I need to do is ask my patient about chief complaint. So I'm going to ask him, sir, can you tell me why did you call us today?
I was carrying boxes up and downstairs, just moving out, and I got this really bad chest pain. I just don't know what to do.
Okay, so my patient's chief complaint is he was moving boxes up and down the stairs, and he has chest pain. The other thing I need to do is consider apparent life threats, so I would expose my patient, and I'm going to look head to toe for any immediate life threats, anything that would affect airway, breathing, or circulation.
No life threats found.
All right. So next thing I need to do is ABCs. So my patient has a patent airway because they're speaking to me. I move down to breathing. Need to assess my patient's breathing. So I'll do that by placing a hand on the chest. I'll look at my watch, and I'm going to obtain a respiratory rate while looking at the rhythm and the quality. I'm looking for equal and bilateral rise and fall of the chest.
Respiratory rate is 20, equal and bilateral.
Okay, based on that, and the fact that my patient has chest pain, I'm going to go ahead and give him a non-rebreather mask connected to 15 liters per minute, 100% oxygen. I want to make sure that the patient's able to tolerate the mask, and I'm going to ask if my O2 therapy is adequate.
O2 therapy is adequate.
Okay, now we'll move down to circulation. So I need to check 3 things here. I'm going to assess my patient's radial pulse because he's conscious. I'm going to check the rate, the rhythm, and the quality. I want to know if he has a regular rhythm, and the quality, I want to know if it's strong or if it's weak and thready.
You have a heart rate of 120 and weak.
Okay, so I'm going to note that. Another thing I need to do is look head to toe, check for any major bleeds.
No major bleeds found.
And I'll check the patient's skin color, temperature, and condition.
Skin is pale, cool, and clammy.
All right, so based on that information, my patient is exhibiting signs and symptoms of shock, so I'm going to treat him with a blanket to keep him warm. At this point, based on my patient's general impression, the complaint of chest pain, he is a high priority transport. We can also consider our GCS to be a 15. All right, he has normal eye opening, his verbal response is normal, and his motor response is normal. So I'll move down to history taking. I'm going to start my OPQRST questions. So I'm going to start by asking the patient, onset, when did this start?
About 15 minutes ago.
Okay, so the patient's pain started 15 minutes ago. When it started, clarifying question, was it acute? Did it come out of the blue, or was it gradual?
It just kind of came out of the blue.
Okay, so it happened suddenly.
Yeah.
Okay. Provocation, does anything make your pain feel better or worse?
Movement makes it worse, and rest, sitting down, just makes it a lot better.
Okay.
But still not good.
Okay. So, provocation, pain, you have pain, or you're exhibiting more pain on movement, and it's a little bit better when you rest. Quality, I'm going to ask the patient if he can describe the pain.
It's kind of like a crushing pain. It's overwhelmingly crushing.
Okay, so quality is overwhelmingly crushing. Has it always felt that way?
Since it started, yeah.
Okay. R is for radiation, so I'm going to ask the patient to point and tell me if the pain moves or travels anywhere.
if I move, it kind of travels to my left arm a little bit.
Okay, so the patient has pain that radiates to his left arm. S is for severity. So on a scale of 1 to 10, 1 being little to no pain and 10 being the worst pain of your life, what is your level of pain right now?
Right now it's 10 out of 10.
Okay, what was your level of pain when it started?
It wasn't as bad when it started, but it still was like about an 8 out of 10.
Okay, so it started as an 8 out of 10 and is now a 10 out of 10.
Yeah.
So that tells us it's progressively or progressing, worsening. Time, so I'll ask about time. Has this pain been constant or does it come and go?
Constant.
Constant pain. Okay, another thing I'm going to ask is, has the patient done anything to help themselves?
I have not done anything though.
So you haven't taken any medications or done anything to help yourself in any way?
Not since then. Earlier I took penicillin though.
Okay. And has this ever happened to you before?
No, it hasn't.
Okay. Next I'll move into sample questions. So signs and symptoms are things that the patient has either told me or I'm observing. I'd ask about any allergies.
Allergies is penicillin.
Okay. So before you mentioned you take penicillin?
No, I meant, I'm sorry, I'm so confused right now. I meant I'm allergic to penicillin.
Okay, so our patient's allergic to penicillin, so we'll note that. Medications, do you take any medications?
Metropolol?
Okay, so you take metoprolol. I believe that's a beta blocker for hypertension.
Yeah.
Pertinent past medical history.
I got like hypertension and they said I got a bad heart. Sometimes I don't know.
All right. Do you see a doctor regularly for your heart condition?
Yeah, I do.
Okay, and you don't know what it is?
Not really, no.
Okay. Last oral intake, what was the last thing you had to eat or drink? When was it?
Breakfast,
About how long ago?
about 4 hours ago.
Okay. And events leading up to this, what happened?
Just moving, I was moving up and down the stairs, I was just moving boxes.
Okay, so physical exertion.
Yeah.
All right. All right, so OPQRST is done. Now we'll perform a secondary assessment. So one thing, I'll start with the cardiovascular system. I'm just going to palpate the patient's chest, and I'm going to ask if the pain worsens at all with palpation.
Yeah, it works.
So it hurts when I press on it?
Yeah.
Okay. All right. Next thing I can do is a range of motion test for musculoskeletal. So I'll ask the patient to put his arms out in front of him, out to the side, and up above his head, and I'll ask him to tell me, I'll ask if the pain has changed at all.
It's still the same.
Okay. Another thing I can do is listen to the patient's heart. So I'll do that, and we'll see if the patient has any irregular heart sounds, or if the heartbeat is irregular in any way. How does the patient's heart sound?
Strong.
Regular rhythm?
Yep, regular rhythm and strong.
Next thing I'll do while I'm here is listen to the lungs in all 6 spots. Take a deep breath.
Lung sounds are clear.
And we'll check mid-axillary. Lungs are clear, which is good. One thing we note is whether or not there was any fluid in the lungs, any crackles, any rales. Another thing I can do is reassess the patient's skin color, temp, and condition. All right, I would also expose my patient, look for any bruising.
No bruising found?
Nothing noted. All right, and again, I just reconfirm that there was no pain or trauma in any way. All right, so at this point, I'm going to go down and obtain vital signs. All right, so I'll start by rechecking my patient's pulse, checking the rate, rhythm, and quality.
No change to pulse.
Okay, so the patient had no change. I'm getting 120 for a pulse rate. All right, I'll reconfirm my patient's respiratory rate. Checking for rate, rhythm, and quality. Equal rise and fall of the chest.
20, no change,
Okay. Making sure my O2 therapy is still adequate.
still adequate,
Okay. I'll recheck the skin color, temp, condition.
pale, cool, and clammy.
Noted. Another thing I will do is obtain a blood pressure. So I understand that the patient has pain that radiates to his left arm. I can ask him if it's okay to take a blood pressure on this arm. If it is, we'll go ahead and do so.
Blood pressure is 140 over 92.
140 over 92, noted. Okay, I could also check my patient's pupils if I wanted, just to make sure that they're equal and reactive.
Pupils of pearl.
Okay. All right, so at this point, my field impression is my patient is suffering from an MI, a myocardial infarction. All right, based on that, I'm going to want to administer aspirin and nitroglycerin to help relieve the patient's chest pain. So therefore, I need to call med control and give a patch. So my patch would be that I have a 55-year-old male patient coming from home complaining of crushing, constant 10 out of 10 chest pain that radiates to his left arm. I'm going to state that upon arrival, I found the patient inside sitting in a chair. He reported that he was moving boxes up and down the stairs, in and out of his basement when this chest pain came on suddenly. It's relieved with rest. However, he has 10 out of 10 chest pain as it is right now. Patient has a cardiac history, has a bad heart, and has hypertension. At this point, we've obtained vital signs, which were a blood pressure of 140 over 92, a respiratory rate of 20, and a heart rate of 120 with pale, cool, and clammy skin. The patient's being treated with high-flow oxygen via non-rebreather, and we're requesting permission to give aspirin, 324 milligrams, PO or oral, in addition to 0.4 milligrams of nitroglycerin to relieve his chest pain. So based on that information, I'm going to ask med control if I have permission.
Permission granted.
All right, so at that point, what we would do is we would obtain our aspirin, and we're going to make sure that we give the aspirin the right route, we're going to check the date, make sure that it's not expired. We're going to make sure that it's the right dose. So this is 81 milligram tablets, so we're going to give them 4. We're going to make sure that we're giving it to the right patient, that it's for them. And we, again, want to confirm that we're giving the right medication. We're also going to make sure that this isn't expired, and we'll document. So what I would do is pour or give 4 tablets to the patient and ask them to chew them. Before I give it, I also want to make sure that the patient is not allergic to aspirin, and I also want to make sure that they don't suffer from any ulcers or bleeding disorders. Next, we would want to give the patient nitroglycerin. Before we give it, we want to make sure that the patient hasn't taken erectile dysfunction meds within 24 to 48 hours. Those medications include Levitra, Cialis, or Viagra. Another thing we want to make sure is that the patient has a blood pressure that's greater than 100 systolic. Based on that, again, we check the date, dose, the route, patient, medication, and we give them 1 tablet sublingual under the tongue. After that, we're going to reassess our patient. We want to reassess him every 5 minutes to see if his condition has changed. And then after that, we would give our arriving report to EMS. At this point, I have completed my station. Thanks for watching. If you found this video helpful, make sure you give it a thumbs up, and don't forget to subscribe. As always, take care and be safe.